Ensuring the mental health of healthcare workers is a critical factor in sustaining COVID-19 preparedness, response, and recovery. So what does the data tell us about COVID-19's mental health impacts? And what are the potential effects on medical professionals, and then by extension on all of us, because we're relying on them? I asked Dr. Matthew Cook, who treats chronic stress.
It's a very high stress environment for people to be out on the front lines, taking their lives into their own hands. And we know that there's been healthcare providers who've died. And I liken it to being in kind of a chronic fight or flight state that's hard to come out of. And then when the same stress, i.e. going to work, is placed on that person every day, it can certainly add up. And so we're hearing a lot of stories, and my heart certainly goes out to the people on the front lines.
How big is this going to be, long term? Because we know doctors, they're at increased risk of suicide compared to the average population. They deal with stress, anxiety, depression. Many times they're perfectionists. Then you put this into the mix of, a high stress situation. Is it going to be 25% of doctors, half of doctors, nurses who need help? What is it?
I think it's going to be a relatively small number because there's a relatively small number of doctors who are really on the front lines. And I'm thinking about emergency room doctors, ICU doctors, anesthesiologists, people who are out there really taking care of these people. As a society, we've done a pretty good job flattening the curve. But what I think this highlights is a problem that's been going on in medicine for a long time that nobody likes to talk about. There's a sense, if you're a doctor, that if I admit to you that I have any problem, then I'm admitting that I have a problem, and then all of a sudden, doctors begin to lose their trust. And so we traditionally in the healthcare field have not done a good job of dealing with this head on, and I think this is an opportunity for us to say, hey, we got to take care of ourselves and do a little bit better job.
With that in mind, I know you treat people things like fight and flight. I mean, the deleterious effects on their bodies long term. Knowing that these doctors and nurses and health aides, we need them. How do we treat them?
So there's a host of things that we do. There's some simple things that I think are quite effective and helpful, and that's like cognitive behavioral therapy. I think group therapy and areas where people can sit and share their experience and talk through it can be very helpful. I take care of a lot of patients who have PTSD, and we use ketamine therapy, which has been profoundly helpful. It seems to reset the fight or flight nervous system. One tool that may be helpful for a lot of people is to do something called a stellate ganglion block, and we do an injection into the neck, and we turn the fight or flight nervous system off for about a day, and that seems to reset the fight or flight nervous system and help people get better.
The bottom line advice here is stress presents in many ways.